I'm Chris Day, Director of Engagement at CQC, and this is a short video. I'd like to set out some of the more detail around our role in local authority and integrated care system assessment. So we know from state of care and over the last probably 6 years, the impact that one sector has on another in terms of people's experience of care. We know that although we assess individual providers, so much about people's experience is about the relationship between different organisations. It's vital that we can assess that interaction on behalf of people if we're to give a real account of how people are experiencing services today. Within CQC, I think there's a really important, we're looking at changing the nature of the roles and operations. And for me, there's something really important in that. We know that it's important that inspectors can carry on regulatory activity against organisations. It's important we can protect individuals as we take that individual action against organisations. But it's also important we understand the relationship between organisations. So the new role of an assessor is trying to bring together all that we know, not just about individual organisations, but about the interplay between them. And I see those roles being a really sort of important part of how we'll look at how systems are performing locally. So we'll see, for example, information from delayed discharge, information from ambulance delays, and information from access to domiciliary care, and for the first time be able to put that together in a way that will be able to give the ICS and the local authority the action that they need to take locally to improve services for people. I also think that we'll be better at getting the views of people more regularly, so not just around individual inspections, but we'll be able to have sort of an always-on view from people giving us that information about how services are working, so that we can take action not just against individual providers, but give system leaders the understanding about what they need to do. This is partly about building trust with providers, partly about building trust with people, so that we can make these new regulations really work. I really want, when I joined the organisation, it was all about how many inspections we'd done, and that was our measure of success. For me, the real excitement here is having a view on areas and talking about what's changing in Birmingham, what's changing in Norwich, what's changing in Cumbria around how services are working for people. And I think this gives us an ability to really drive change, not just at provider level, but at the system level. But giving that view, that constant, always on view of quality, I think will transform the way we improve services. I also think there's something really tangible about being able to offer that information back to people so they can see that view, those views of services and the services in their area more in real time. And I think also for our own staff, we've done a lot to change the way health and care services work. But I think by only looking at providers, I think we limit what we can do. And I think we've got the ability to transform the information we offer to providers, transform the way in which we do inspection and regulation activity, so that we have more impact as an organisation, which for me has never been a more important time to be able to have that impact. So I'm really excited about the future. I'm really excited about being able to use that evidence, that information to provide that always on view of quality and to drive change both at a local provider level, at a system level, and indeed at a national level.